Hello, beautiful and amazing people. My name is Dr. David Hartwig. I am a doctor of physical therapy and the owner of Atlas Health and Wellness. Atlas Health and Wellness provides preventative care and physical therapy and helps empower people shoulder the weight of their world. And that includes whether you're a stay-at-home mom who likes to dance, or you're a accountant that spends a great deal amount of time sitting, and you also enjoy running to try to stay fit. We're here to empower you so that you can exercise and reduce the likelihood of your arthritic conditions, which can develop with weakness of the musculoskeletal system. Today, our topic is going to be discussing common injuries associated with dancing. And I chose a neutral website, Fred Astaire, so it's not a physical therapy website. I also teach dance. I teach the dance known as Lindy Hop every Thursday night here at Powerhouse Gyms. From 7 to 8, we teach the basics, and as we expand, we will add more classes. So if you are interested in learning the partner dance known as Lindy Hop and to learn how to partner dance with and socialize with other people, come visit us. I guarantee you'll have a blast. So let's get into it. So the 7 most common dance injuries and how to prevent them, according to Fred Astaire, who is a very successful franchise in the dance community. They teach a variety of different dances, and I believe they also teach some forms of swing. All right, so ankle sprains are the most common type of injury. Ankle sprains are the most common acute injury in dancers. They happen when something forces the ankle outside of its normal range of motion, tearing and overstretching the ligaments around the ankle. More specifically, it's the anterior talofibular ligament that is often strained. And I would argue that a lot of this has to do with an inability to dorsiflex. If you have the development of a plantar flexion contracture, which predisposes the ankle in a position that would stress the anterior talofibular ligament. That is true. Stretching and stabilizing exercises with balance and things like that can help reduce your risk of these problems. If you don't know what your ankle range of motion is, if you don't know what 20 degrees of dorsiflexion looks like, I usually recommend that patients keep their dorsiflexion around 15 degrees of dorsiflexion to help limit the potential of getting a lateral ankle sprain. You can have a deltoid ligament sprain, but that's very uncommon, especially if you're an elite dancer. Achilles tendonitis. So this kind of goes hand in hand with what I was mentioning before in terms of plantar flexion contractures. When the posterior compartment, which is the calf muscles, becomes excessively tight, it puts more stress on the Achilles tendon and also can contribute to things like plantar fasciitis. So dorsiflexion, or the range of motion of your ankle, which should be about 15 degrees to 20 degrees of dorsiflexion according to the American Orthopedic Association. Usually I find that individuals that I treat, unless you're a hypermobile individual, like individuals living with Ehlers-Danlos syndrome, they often have between 3 degrees. I've seen some clients with negative dorsiflexion, which really puts stress on the back, the hips, because there's less shock absorption. So if you are a dancer and you want to make sure that you can continue dancing into the later years of your life, go ahead and contact us. By the way, our phone number is 954-932-8527. If you got questions, you can reach out to us at info@atlashealthandwellness.com. All right, so trigger toe, or flexor hallucis longus tenosynovitis, is often a problem, and it also goes back to exactly what I was just talking about before. The flexor hallucis longus is one of the tendons that goes into the great toe, and the size of this muscle is much larger than people realize, and it's in the calf muscle, and it's in the posterior compartment. And if it is too tight, it will cause all kinds of problems at the great toe. And this problem is often career-ending for some dancers. It's career-ending for some football players, and it is completely avoidable if you know that you have deficits in the range of motion of your great toe and your ankle. But you wouldn't know that unless you schedule an evaluation to have these things managed preventatively. Ankle impingement. Now, this one's a little interesting. This is a pain that occurs in the front of the ankle, and typically bothers people that are hypermobile in nature. It is not necessarily individuals that have plantar flexion contractures. It's more so individuals that are hypermobile and into dorsiflexion. And what we do with that is we try to stabilize the ankle and strength train the muscle surrounding the ankle to give it more stability so that the joint is more stable. That's number 5. Snapping hip syndrome. So there are several tendons that cross the hip, and those tendons can become irritated if continually rubbed against the bony prominences which they pass. And one of them, iliopsoas, can be a problem. The knee extensors can be a problem, specifically rectus femoris. And you got also snapping hip syndrome or snapping knee syndrome. But if you stretch your hip flexors and know what your hip extension range of motion should be, then these problems can be greatly avoided. Also, strengthening the gluteus medius and hamstring musculature also helps stabilize the pelvis and makes things not move around so much. Hip impingement. Okay, femoral acetabular impingement syndrome. Basically, the hip can become irritated if you are excessively mobile. This often happens with dancers, specifically with females, because they are hypermobile. They may have some underlying hip dysplasia that they're not aware of. And how would you become aware of these things? Well, you would get in a wellness evaluation with us, and we would take a look at how your hips are moving. If you already have femoral acetabular impingement syndrome, it can be a tricky diagnosis to treat. Hopefully, it is not due to the labral involvement or the labrum of the pelvis getting, or the femoral acetabular joint getting irritated. And so if you have groin impingement, it's a pain in the front of the groin area, especially when your hip is excessively flexed, you need to schedule an evaluation with a physical therapist, or if you want to help avoid these problems, schedule your wellness evaluation with Atlas Today. Jumper's knee or patellofemoral pain syndrome. Now, this is very, very common. I teach Lindy Hop. It's a very bouncy dance. It has a lot of uncomfortable positions that you will put yourself in, and you need to train specifically for the dance. And I have suffered from ankle and foot problems as a dancer, not so much the knee, because I realized that I need to strengthen my hamstrings, but because of the nature of the bounciness, my calves get tight. But enough about me. So basically, the patellofemoral pain syndrome is usually the result of muscular weakness. And it affects females more than males because of a couple things. Number one, hormone imbalances, or not imbalances, but differences between men and women. Women are 4 to 9 times more likely to sustain ligamentous injuries than males. And it's 4 to 9 times more likely because your hormones change as the month progresses. And, you know, if you're older and you've gone through menopause, you might be the exception to the rule in that. But bottom line is that weakness because of your hip width, weakness because of your hormone levels, weakness because of blood loss related to menstrual cycles can all contribute to weakness of the hamstrings and gluteus medius, which cause a valgus stress at the knee. And if this is left unchecked, if you don't know what your strength or force production is, it should be 36% of your body weight, but most people don't know what that is. So here at Atlas Health and Wellness, we use really fancy strength dynamometry technology to pinpoint exactly how much force production you need to be making and above. There's no such thing as too strong, just too weak. And if you don't know if you're one of those people, schedule your wellness evaluation and we'll get that figured out for you. Our evaluations are 100% free. All right. General tips to prevent dancing injuries. All right. In dancing, just as with any sport, it is important to listen to your body and get adequate rest. Overtraining always backfires in form of exhaustion and injury, so don't push yourself beyond reasonable limits. Pain is your body's way of telling you that something is wrong, so you should never try to push through the pain if it seems excessive or unusual. Yes, I couldn't agree more. Pain is the terminal problem, the terminal symptom of underlying inflammation. And if it is ignored, it can really put you out of the game. It's not necessary to live with inflammation if you train appropriately. But most people, although they are well-intentioned in how they train, they want to make sure that, hopefully I'm not getting kicked here. I'm still here. I am in the call. Don't kick me out yet. I'm not done rambling. Anyway, so basically what I'm here to teach you is how to care for your body individually, whether you're a man or a woman, and whether you're young or old, whether you're a pro or just a novice. We at Atlas Health and Wellness are here to empower you to shoulder the weight of your world, whether that's dancing, running, taking care of your kids, playing football. I don't care. What I do care about is helping people live their best life and understanding how to take care of the machine that carries their brain around on a day-to-day basis so that they can live well into their old age without suffering unduly. My name is Dr. David Hartwig. If you would like to schedule a wellness evaluation with us, call 954-932-8527. We look forward to making your acquaintance in the very near future. Have a great day.